Question 1. What is the first step in ensuring medication safety when administering oral medications? Checking the patient's ID band. B. Verifying the medication order. C. Preparing the medication. D. Checking the patient's medical history. Answer: B. Verifying the medication order. Rationale: verifying the medication order is essential to ensure that the correct medication, dose, and route are being administered. Checking the ID band and preparing the medication are important, but the first step is verifying the order. Question 2. Which of the following is the most appropriate action to take when a medication error occurs? Ignore the error if it doesn't cause harm. B. Report the error immediately. C. Wait until the end of the shift to report the error. Blame the person who made the error. Answer: B. Report the error immediately. Rationale: immediate reporting of medication errors ensures prompt action to mitigate harm and prevent further errors. Waiting or ignoring the error could lead to patient harm. Question 3. A patient is prescribed a medication that has a known drug interaction with another medication they are taking. What is the nurse's primary responsibility? Ignore the interaction if the patient is asymptomatic. B. Administer both medications as prescribed and document the interaction. C. Inform the healthcare provider of the potential interaction. D. Discontinue the medication immediately. Answer: C. Inform the healthcare provider of the potential interaction. Rationale: the nurse must notify the healthcare provider about potential drug interactions to ensure patient safety. Ignoring or discontinuing the medication without a physician's guidance could harm the patient. Question 4. What is the correct method for administering a subcutaneous injection? Insert the needle at a 90-degree angle into the skin. B. Insert the needle at a 45-degree angle into the skin. C. Insert the needle directly into a vein. D. Use an intramuscular needle for subcutaneous injections. Answer: B. Insert the needle at a 45-degree angle into the skin. Rationale: subcutaneous injections are typically administered at a 45-degree angle to avoid injecting too deeply into muscle tissue. Using the wrong technique can cause complications. Question 5. When administering a medication via nasogastric tube, NGT, what should the nurse do first? Flush the tube with 5 to 10 milliliters of water. B. Check the tube placement to ensure it's in the stomach. C. Administer the medication. D. Ask the patient to swallow the medication. Answer: B. Check the tube placement to ensure it's in the stomach. Rationale: verifying the placement of the NGT ensures that the medication will be properly absorbed. Flushing the tube and administering the medication should only be done after verifying placement. Question 6. Which of the following is a key component of patient education regarding new medication? Teach the patient how to administer the medication properly. B. Only provide written instructions without verbal explanation. C. Emphasize that the medication is entirely safe with no side effects. D. Ignore the patient's concerns about medication. Answer: A. Teach the patient how to administer the medication properly. Rationale: proper patient education involves teaching how to administer the medication safely, addressing side effects, and answering any concerns. Relying only on written instructions is not enough. Question 7. What should a nurse do if a patient exhibits an allergic reaction after receiving a medication? Continue to monitor the patient. B. Document the reaction and notify the physician. C. Administer more of the medication to assess the reaction. D. Ignore the symptoms unless they become severe. Answer: B. Document the reaction and notify the physician. Rationale: immediate documentation and notifying the physician are crucial steps in managing allergic reactions. Ignoring or administering more medication can worsen the reaction. Question 8. What is the nurse's responsibility when administering a high-alert medication? Administer the medication without checking it again. B. Double-check the medication with another licensed nurse. C. Skip the verification process to save time. D. Only check the medication once before administration. Answer: B. Double-check the medication with another licensed nurse. Rationale: high-alert medications require double-checking with another licensed nurse to reduce the risk of errors. This process helps ensure patient safety. Question 9. Which of the following actions should a nurse take to minimize the risk of medication errors in pediatric patients? Administer the medication based on the adult dosage. B. Use a standard adult syringe for medication administration. C. Calculate the appropriate pediatric dose based on the child's weight. D. Avoid administering any medications to pediatric patients. Answer: C. Calculate the appropriate pediatric dose based on the child's weight. Rationale: pediatric doses should be calculated based on the child's weight to ensure the correct dosage. Administering adult doses or using incorrect equipment can lead to errors. Question 10. What is the primary reason for using the 5 rights of medication administration? To ensure the medication is administered as quickly as possible. B. To ensure the medication is administered safely and correctly. C. To minimize paperwork for the nurse. D. To ensure the patient receives medication only when they request it. Answer: B. To ensure the medication is administered safely and correctly. Rationale: the 5 rights, right patient, right drug, right dose, right time, right route, are used to ensure that medications are administered safely and accurately. Question 11. A patient has been prescribed a new medication and is experiencing dizziness. What should the nurse do first? Continue administering the medication without concern. B. Report the dizziness to the healthcare provider and hold the medication. C. Ask the patient to rest and reassess after an hour. D. Discontinue all medications immediately. Answer: B. Report the dizziness to the healthcare provider and hold the medication. Rationale: dizziness may be a side effect or a sign of a more serious issue. Reporting it to the healthcare provider and holding the medication is crucial for patient safety. Question 12. When preparing to administer a medication via intravenous, IV, push, the nurse must A. Administer the medication rapidly for quick effect. B. Confirm that the foresight is patent before administration. C. Administer the medication only after it has been diluted. D. Immediately remove the IV needle after administration. Answer: B. Confirm that the IV site is patent before administration. Rationale: verifying that the IV site is patent ensures that the medication will be delivered correctly. Administering it without checking could cause complications such as infiltration. Question 13. What is the most important factor when calculating medication doses? A. The patient's gender. B. The patient's body surface area. C. The patient's age. D. The patient's weight. Answer: D. The patient's weight. Rationale: weight is the primary factor in calculating medication doses, especially for pediatric and elderly patients. Gender, age, and surface area may also play a role but are secondary. Question 14. What should a nurse do if a medication has been administered but the patient is found to be allergic to it? Wait for the medication to wear off. B. Notify the healthcare provider and follow emergency protocols. C. Administer the antidote to reverse the effects. Document the reaction and monitor the patient. Answer: B. Notify the healthcare provider and follow emergency protocols. Rationale: notifying the healthcare provider immediately ensures that appropriate actions are taken to manage the allergic reaction, including administering an antidote if necessary. Question 15. What is the best approach for a nurse when preparing to administer medication to an elderly patient? Follow the same procedure as for young adults. B. Consider potential age-related changes in medication absorption and elimination. C. Administer the maximum prescribed dose for elderly patients. D. Avoid administering any medications to elderly patients. Answer: B. Consider potential age-related changes in medication absorption and elimination. Rationale: age-related changes can affect medication absorption, distribution, metabolism, and elimination, requiring adjustments in dosing. Question 16. A nurse is administering a medication that the patient refuses. What is the best action to take? Force the medication on the patient for their safety. B. Document the refusal and inform the healthcare provider. C. Ignore the refusal and proceed with administration. D. Tell the patient they must take the medication. Answer: B. Document the refusal and inform the healthcare provider. Rationale: patient autonomy must be respected. Documenting the refusal and informing the healthcare provider allows for follow-up and reassessment of the treatment plan. Question 17. When should a nurse assess the patient for any side effects of a newly prescribed medication? Only after the patient expresses discomfort. B. Prior to administering the medication. C. During the first hour of medication administration. D. Continuously throughout the administration process. Answer: C. During the first hour of medication administration. Rationale: the first hour after administration is crucial for monitoring side effects, as they are often most evident during this time. Question 18. What is the correct action if a nurse identifies a discrepancy between the medication order and the medication prepared for administration? Continue with the administration without further checks. B. Notify the healthcare provider and verify the order. C. Administer the medication and report later. D. Withhold the medication without notifying anyone. Answer: B. Notify the healthcare provider and verify the order. Rationale: the nurse must verify discrepancies with the healthcare provider to ensure that the right medication is being administered. Continuing without verification could result in a medication error. Question 19. A patient is prescribed warfarin and is also taking over-the-counter aspirin for pain. The nurse identifies a potential drug interaction. What is the nurse's priority action? Continue the current regimen and monitor the patient's condition. B. Discontinue aspirin and consult the healthcare provider about alternative pain management. C. Administer both medications and observe for adverse effects. Document the interaction and wait for the patient to report symptoms. Answer: B. Discontinue aspirin and consult the healthcare provider about alternative pain management. Rationale: warfarin and aspirin together increase the risk of bleeding. The nurse should discontinue aspirin and consult the healthcare provider to discuss alternative pain management options. Continuing the medications without adjustments can harm the patient. Question 20. A patient has been receiving a high dose of corticosteroids for chronic asthma management. The nurse is concerned about the risk of hyperglycemia. What should the nurse do? Monitor the patient's blood glucose levels regularly. B. Advise the patient to stop taking the corticosteroid immediately. C. Administer insulin without a physician's order. D. Increase the patient's carbohydrate intake to counteract the effect. Answer: monitor the patient's blood glucose levels regularly. Rationale: corticosteroids can increase blood glucose levels, especially in patients with diabetes or those at risk for hyperglycemia. Monitoring glucose levels allows early detection of changes and timely intervention. Question 21. A nurse is administering a medication to a patient with liver disease. Which of the following should the nurse be most concerned about? A. The patient's ability to metabolize the drug. B. The patient's ability to tolerate pain. C. The patient's ability to absorb the drug. D. The patient's ability to digest the drug. Answer A. The patient's ability to metabolize the drug. Rationale: liver disease affects the metabolism of many drugs, leading to an increased risk of toxicity. The nurse must assess the liver function and adjust medication dosages accordingly. Question 22. A patient who has been taking digoxin for heart failure reports seeing yellow halos around lights. What is the nurse's priority action? Encourage the patient to continue taking the medication as prescribed. B. Hold the digoxin dose and notify the healthcare provider immediately. C. Document the symptoms and schedule a follow-up appointment. D. Administer an anti-nausea medication to relieve symptoms. Answer B. Hold the digoxin dose and notify the healthcare provider immediately. Rationale: yellow halos are a sign of digoxin toxicity. The nurse should immediately hold the dose and notify the healthcare provider to prevent further complications. Question 23. A nurse is administering an intravenous medication that requires a slow infusion. Which of the following is the best action for the nurse to take? Administer the medication rapidly to avoid a delay in treatment. B. Monitor the patient for adverse reactions and adjust the rate as needed. C. Wait for the patient to express discomfort before adjusting the infusion rate. D. Discontinue the infusion if the patient shows signs of discomfort. Answer B. Monitor the patient for adverse reactions and adjust the rate as needed. Rationale: some intravenous medications require a slow infusion to prevent adverse effects, such as phlebitis or hypotension. The nurse should monitor the patient and adjust the rate according to the prescribed guidelines. Question 24. A patient is receiving a medication that is contraindicated in pregnancy. The patient reports that she is pregnant. What is the nurse's priority action? Administer the medication as prescribed and inform the healthcare provider afterward. B. Continue administering the medication but advise the patient to stop breastfeeding. C. Discontinue the medication and notify the healthcare provider immediately. D. Tell the patient to continue the medication until the healthcare provider is available. Answer C. Discontinue the medication and notify the healthcare provider immediately. Rationale: medications contraindicated during pregnancy can harm the fetus. The nurse should discontinue the medication and notify the healthcare provider to find a safer alternative. Question 25. A nurse is administering a medication to a patient with a known allergy to penicillin. What is the nurse's responsibility? Administer the medication as prescribed and monitor for any reactions. B. Substitute another medication without informing the healthcare provider. C. Verify the patient's allergy history and ensure no cross-reactivity with the prescribed medication. D. Administer the penicillin as prescribed because the allergy is mild. Answer C. Verify the patient's allergy history and ensure no cross-reactivity with the prescribed medication. Rationale: the nurse must verify that the prescribed medication does not contain penicillin or any related drugs that might cause an allergic reaction, even if the allergy is mild. Question 26. A nurse is administering a medication to a patient with a history of renal impairment. Which action should the nurse take before administration? Administer the medication as usual and monitor the patient's urine output. B. Calculate the correct dose based on the patient's weight only. C. Adjust the medication dose or contact the healthcare provider to discuss alternatives. D. Avoid administering the medication and contact the healthcare provider immediately. Answer C. Adjust the medication dose or contact the healthcare provider to discuss alternatives. Rationale: renal impairment can affect the elimination of many medications, leading to a risk of toxicity. The nurse must adjust the dosage or contact the healthcare provider to prevent harm. Question 27. A patient on anticoagulants is scheduled for a surgical procedure. What should the nurse do prior to the surgery? Continue the anticoagulant therapy as prescribed. B. Discontinue the anticoagulant therapy and monitor for any signs of clotting. C. Assess the patient's bleeding risk and notify the healthcare provider. D. Administer an antidote to reverse the anticoagulant effect. Answer: C. Assess the patient's bleeding risk and notify the healthcare provider. Rationale: the nurse should assess the patient's bleeding risk and inform the healthcare provider, as anticoagulants need to be adjusted before surgery to prevent excessive bleeding. Question 28. A patient who has been prescribed an opioid for pain relief is at risk for respiratory depression. What is the nurse's priority intervention? Encourage the patient to take deep breaths every 10 minutes. B. Monitor the patient's respiratory rate and oxygen saturation regularly. C. Administer the medications slowly to avoid complications. D. Instruct the patient to rest and limit movement. Answer: B. Monitor the patient's respiratory rate and oxygen saturation regularly. Rationale: opioids can cause respiratory depression, and monitoring the patient's respiratory rate and oxygen levels is crucial for early detection and intervention. Question 29. A nurse is administering a medication via inhalation for asthma management. What is the proper technique for the patient to use? Inhale quickly and hold the breath for 2 to 3 seconds. B. Inhale slowly, hold the breath for 10 seconds, then exhale slowly. C. Exhale before administering the medication. Hold the inhaler at arm's length and inhale through the nose. Answer: B. Inhale slowly, hold the breath for 10 seconds, then exhale slowly. Rationale: inhaled medications for asthma should be taken with a slow, deep breath, and holding the breath helps ensure proper distribution of the medication in the lungs. Question 30. A nurse is preparing to administer a medication that has a narrow therapeutic index. What is the most important consideration? Administer the medication quickly to achieve therapeutic levels. B. Closely monitor the patient's response and adjust the dose as necessary. C. Increase the dosage to speed up therapeutic effects. D. Avoid administering the medication unless absolutely necessary. Answer: B. Closely monitor the patient's response and adjust the dose as necessary. Rationale: medications with a narrow therapeutic index have a small margin between therapeutic and toxic doses. Close monitoring and dose adjustments are crucial to ensure safety. Question 31. A patient is receiving an infusion of a chemotherapy drug known to cause severe nausea. Which of the following actions should the nurse prioritize? Administer an antiemetic medication before the infusion. B. Wait for the patient to request antiemetics. C. Increase the infusion rate to finish the treatment quickly. D. Administer the chemotherapy drug without any pre-medication. Answer: A. Administer an antiemetic medication before the infusion. Rationale: administering an antiemetic prior to chemotherapy helps prevent nausea and vomiting, as these medications are highly effective when given prophylactically before chemotherapy. Delaying or waiting for patient complaints can lead to uncontrolled symptoms. Question 32. A nurse is caring for a patient on digoxin and potassium-wasting diuretics. What lab result is most concerning? Potassium level of 4.5 milliequivalent per liter. B. Sodium level of 138 milliequivalent per liter. C. Magnesium level of 2.0 milligrams per deciliter. D. Potassium level of 2.8 milliequivalent per liter. Answer: D. Potassium level of 2.8 milliequivalent per liter. Rationale: a potassium level of 2.8 milliequivalent per liter is dangerously low and places the patient at increased risk for digoxin toxicity, which can lead to arrhythmias. Potassium-wasting diuretics and digoxin both lower potassium levels, requiring careful monitoring. Question 33. A patient is being treated for sepsis and is receiving vasopressors. The nurse notes a decrease in urine output and cold extremities. What is the nurse's priority action? Increase the dose of the vasopressor. B. Notify the healthcare provider and assess for signs of ischemia. C. Discontinue the vasopressor immediately. D. Apply warm compresses to the extremities. Answer: B. Notify the healthcare provider and assess for signs of ischemia. Rationale: a decrease in urine output and cold extremities while on vasopressors may indicate poor perfusion and ischemia. Immediate assessment and communication with the healthcare provider are essential to prevent organ damage. Question 34. A patient on long-term corticosteroid therapy for autoimmune disease develops osteoporosis. What is the nurse's primary concern? Encourage weight-bearing exercises to prevent fractures. B. Recommend calcium and vitamin D supplementation. C. Monitor for signs of infection due to immunosuppression. D. Continue the corticosteroid therapy without adjustment. Answer: B. Recommend calcium and vitamin D supplementation. Rationale: corticosteroid therapy can lead to bone loss, increasing the risk of fractures. Calcium and vitamin D are essential for bone health and should be recommended to help mitigate this risk. Question 35. A nurse is administering an opioid analgesic to a patient post-surgery and notices that the patient's respiratory rate is 8 breaths per minute. What is the nurse's immediate intervention? Administer naloxone and monitor the patient. B. Increase the oxygen flow rate. C. Increase the opioid dosage to improve pain control. Wait for the patient to recover and monitor hourly. Answer: administer naloxone and monitor the patient. Rationale: a respiratory rate of 8 breaths per minute is indicative of opioid-induced respiratory depression. Naloxone, an opioid antagonist, should be administered immediately to reverse this potentially life-threatening side effect. Question 36. A nurse is administering a medication to a patient with a known hypersensitivity reaction to sulfa drugs. Which of the following medications should the nurse question? Furosemide, a loop diuretic. B. Trimethoprim sulfamethoxazole, Bactrim. C. Methotrexate, an immunosuppressant. D. Diphenhydramine, an antihistamine. Answer: B. Trimethoprim sulfamethoxazole, Bactrim. Rationale: trimethoprim sulfamethoxazole is a sulfonamide drug and is contraindicated in patients with a sulfa allergy. Administering this drug could result in a severe allergic reaction, including rash, fever, and organ damage. Question 37. A patient with chronic renal failure is on dialysis and receives erythropoiesis-stimulating agents, ESAs, for anemia. What lab results should the nurse monitor closely? Hemoglobin level of 15 g per deciliter. B. Potassium level of 5.2 milliequivalent per liter. C. Hemoglobin level of 10 g per deciliter. D. Hemoglobin level of 20 g per deciliter. Answer: D. Hemoglobin level of 20 g per deciliter. Rationale: ESAs can cause excessive erythropoiesis, leading to dangerously high hemoglobin levels. A hemoglobin of 20 g per deciliter increases the risk of thromboembolic events and other complications, requiring close monitoring and possible dose adjustment. Question 38. A nurse is caring for a patient who has received multiple doses of warfarin. The nurse notes a PT or INR of 5.0. What is the nurse's priority action? Continue the warfarin regimen and monitor for symptoms. B. Hold the warfarin dose and notify the healthcare provider. C. Administer vitamin K as prescribed. D. Increase the warfarin dose to achieve the target INR. Answer: C. Administer vitamin K as prescribed. Rationale: an INR of 5.0 is dangerously high, indicating a risk for bleeding. Vitamin K is the antidote for warfarin toxicity and should be administered to reverse its effects. The nurse should also notify the healthcare provider for further management. Question 39. A nurse is preparing to administer a medication with a known risk for QT prolongation. The patient's electrolyte levels are potassium 3.0 milliequivalent per liter and magnesium 1.2 milligrams per deciliter. What should the nurse do? Administer the medication and monitor for signs of arrhythmia. B. Hold the medication and notify the healthcare provider about the electrolyte imbalance. C. Administer the medication with an additional dose of potassium. D. Continue the medication and plan to correct the electrolytes later. Answer: B. Hold the medication and notify the healthcare provider about the electrolyte imbalance. Rationale: low potassium and magnesium levels increase the risk of QT prolongation, which can lead to fatal arrhythmias. The nurse should hold the medication and notify the healthcare provider to correct the electrolyte imbalance before proceeding. Question 40. A patient receiving multiple antibiotics develops a superinfection. What is the nurse's primary concern? Continue the antibiotics and monitor for additional side effects. B. Discontinue the current antibiotics and administer antifungal agents. C. Administer the antibiotics at a faster rate to combat the infection. D. Identify and treat the underlying cause of the superinfection. Answer: D. Identify and treat the underlying cause of the superinfection. Rationale: superinfections such as C. difficile or fungal infections occur when normal flora are disrupted by broad-spectrum antibiotics. The nurse's priority is to identify and treat the underlying infection, which may require changing the antibiotic regimen.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!